Welcome to the informational webinar for the Virginia Cardiac Services Quality Initiative, also known as VCSQI, STAN 2.0 practices, as we transition to the Vizient Practice Transformation Network, also PTN as an acronym there for you. My name is Shannon Hale, and I'm one of the Quality Improvement Advisors here at Vizient. And we look forward to speaking with you more today about who Vizient is, our Practice Transformation Network, and our delivery model. We think you'll agree that through our unique delivery model approach, our dedicated quality improvement advisor support, as well as the opportunity to connect with other practices that are transforming how care is delivered, that we are an ideal partner in today's ever-changing healthcare landscape. At some point or another, either during this call or during your transition, you'll probably speak with one or all of us listed here on the speaker slide. These are our Vizient colleagues here. And also, we have on the line Debbie Melnick with Virginia Cardiac Services Quality Initiative. Debbie, thank you so much for joining us. Anything you'd like to add before we get started?
Yes, thank you, Shannon. Oh, I'm hearing an echo. But I want to thank all of you for joining today. We at VCSQI are so pleased that Vizient has offered to accept our practices that wish to continue in the TCPI government initiative. And I emphasize the word continue. This is a continuation. So when you transition to Vizient, you are not starting over. The Vizient staff have been extremely flexible and eager to work with us to assure a smooth transition. We encourage all of you to continue the TCPI work with Vizient, even if you've completed all 5 phases, to assure that you stay up to date with the national project and be recognized as participants at the end of the national project next year. Finally, just a quick reminder, all of the PTNs have the same type of contract for TCPI. But each PTN has its own way and methods for achieving the goal with their practices. It's all, though, about improving quality, lowering costs, and getting to a person and family-centered approach to care. So keep your listening skills sharp today to hear about Vizient's approaches. The Vizient staff are exceptional professionals with expertise in quality improvement. And again, remember, this is a continuation that you will be part of. Thank you, Shannon.
Perfectly said. Thank you so much, Debbie. So here is our agenda for today. We're looking forward to discussing with you who we here at Vizient are, for anyone that's not familiar with us. We're looking forward to giving you an overview of Vizient PTN and our delivery model. At the end of the webinar, we'll discuss the next steps that we each need to take. To discuss who we are here at Vizient, I'll turn our discussion over to Colleen Oldham. Colleen is Senior Director for the TCPI Advisory Services. Colleen, hello.
Hi, Shannon, and thank you. And I will echo what Shannon said. I appreciate Debbie. That was a very kind introduction. And we are incredibly excited to be working with each and every one of you on the call today. So a little bit of an overview about who is Vizient. Hopefully some of you have been out there on the internet looking around and or already have a knowledge of who we are as a company. But this one slide says quite a bit of information. You will also receive a PDF that will also give you additional information if you'd like to look at that on our company. But the biggest thing for our company is we're the largest member-driven healthcare performance improvement company in the nation. So that's a pretty tall order given all the flexible issues that are happening within healthcare today. So let me just back it up a little bit by some data. So we are a member-owned company, and we have 3,100 health system members that are part of Vizient. We work with 95% of the nation's academic medical centers and greater than 20% of the nation's ambulatory market. So although we're very large in number, we also have the ability to work down at the individual practice level and at the individual organization level. The second thing that I want you to know about Vizient is that we are really uniquely positioned to work with the company's leading institutions to drive those better outcomes for healthcare providers, most important patients, families, and the communities. There are really 4 ways that we do that. We look at something that's called sourcing services, which some of you may be familiar with, and that's your traditional group purchasing organizations. We take a look at their supply performance, making sure that they're getting the best price for the products that they're purchasing, and we leverage through scale, workflow automation, and the expertise. We also tie that to quality. So the members that are part of Vizient are also part of that process as well. We also have analytic services. And you, as part of the Vizient PTN, you will get to experience part of our analytics service team as part of that. The members were a trusted source for the clinical safety, supply, and financial and operational decision-making with the data that we have. The data that you will be providing us as part of the Practice Transformation Network, our analysts will be working with that data as well. Advisory services, that's another piece of our company that you'll be working with. Shannon will be taking lead on this, as Kirsay will also be working with him, and they will be the quality improvement advisor team. Their main goal is to make sure that they accelerate improvement in the member performance and make sure that you have a transfer of all of the knowledge that we have. So you're not learning in silo. You're actually learning among peers and others across the country. Collaboration services is very big for us here at Vizient. We make sure that we connect the members so that as you work together, we believe that you grow faster and you get better faster together as well. To end it, I want to just talk a little bit about our purpose and our mission as Vizient. We want to ensure that our members deliver exceptional, cost-effective care. So we do that through all of the services that I just spoke with earlier. And our mission here at Vizient is to make sure that we connect the knowledge and solutions and expertise that you're going to need to accelerate your performance. So I'll go ahead and turn it back over to Shannon, I think. I think Kirsay is one of our advisors has laryngitis today, so I'm not sure that you'll be hearing from her, but I think I'll turn it back over to Shannon now.
Thank you, Colleen. Let's go ahead and talk a little bit about our Practice Transformation, or PTN Network, here at Vizient. So these are the currently enrolled organizations with our Vizient offices being in Chicago and Dallas. Those are the purple or bluish dots that you see. But you see the reach that our PTN has. All of the red dots are different organizations that we work with across the country. And it really demonstrates the breadth of our experience in working with practices nationwide, really as we all work to transform the way that care is provided and delivered to everyone. So at the heart of TCPI is high-value, low-cost care. Debbie mentioned this in her moment. And shown here are the 7 aims of TCPI that you're probably already familiar with. You'll also see our PTN metrics measured for each aim. Specifically, if you look at that center section, those aims 2 through 5. At the foundation of TCPI is that TCPI change package from the Healthcare Communities Org website. And I really want to highlight here, one of the strong points that we have within our own PTN is the patient-family engagement. Our PTN puts a strong emphasis on including the voice of the patient and the family, and in doing so, that not only helps us achieve success with each of these aims, but in also transforming healthcare nationwide. Here we have our most current radar diagram from CMS, and we're very proud of the success that we've seen here and that you see. You can kind of look at this and see the success that we've seen so far as a PTN with the various measures. With the next diagram, we do feel confident that we'll hit or come very close to hitting that cost savings goal over on the left-hand side of the slide. But you can already see the success that we've seen as we look at enrollment, reduction in tests and procedures, clinical outcomes. You're seeing that the reduction in hospitalizations, we do have a little bit further to go there. And in the transformation, you may see a little bit of variation, and what that really comes from is the change in definition that CMS has had so far in what defines a transformed practice. We're actually anticipating another change in that definition, but feel confident due to the success that we've had so far that we will meet all of these pieces that you see here on the radar diagram. So next we're going to talk a little bit about the Vizient PTN delivery model here at Vizient and how that's going to look as we move forward. So the Vizient PTN 2.0 delivery model that we'll be working with really stresses a structure and a framework for transformational work, peer-to-peer learning events, as well as aligning national and Vizient resources with project needs. Basically, we will meet you where you are in the transformational journey, and through the VIC model, which is something that we're going to speak about coming up, will help each of us transform and we'll build a community together. Now here on this slide is the VIC model that I was discussing, and VIC stands for Vizient Improvement Community. VICs are facilitated by a dedicated quality improvement advisor, that would either be myself or PeerSafe, with a cap of 25 practices per VIC. In a bit, we'll talk about a quick survey link that you'll be receiving after the call. And in that survey, we'd love to hear how you would like these VICs to be organized, such as by specialty or by region of the country that your practice is located in. Certain quality improvement projects maybe that you're working on there in your practice. A little more to come on that in just a bit. The VICs are small enough to foster open dialogue, but large enough to provide that peer-to-peer learning from a variety of practices. The Quality Improvement Advisor will facilitate the VIC, using part of each session to focus on best practices and accomplishment of practices. These are not necessarily large, but possibly small increments that lead to transformation. If you have something that you want to highlight there in your practice and a patient has been involved or a family member has been involved, by all means, we want you to invite them to the VIC call, that first half most likely, so we can hear their part, their take of that change. We really want to highlight that piece. Each VIC will meet formally for 1 hour every month by webinar. And then in addition to that, we'll also have office hours. They will be virtual. And those will be scheduled each week for practices just to drop in and ask any questions that you have. We really want to be that support and that trusted partner for you as we move through the TCPI program and towards that value-based care. Each practice will be notified of and invited to join other technical assistance calls that we have. Ensuring a strong finish. Obviously, that's what we're all working towards. So during our VIC calls, we'll discuss the various topics that are key to TCPI and projects in your practices. In fact, the VIC call topics are focused around change package topics that are driven by your needs. A lot of these topics you're probably already familiar with, and just a few of them are listed here for you. Team-based care, community partners, joy in the workplace, success stories. We want to help you use data to drive transformation. And that's just a few of those options there for you. The next steps. So now what? What do we need to do? Let's talk about that. So immediately following today's webinar, I'll send to you an email. And in that email, there will be a PDF of today's presentation, a link to today's recording, and also a survey link. The survey link, I really want to highlight this, is very short and sweet. It's 4 questions. And in looking at the responses, it has taken on average about 2 minutes to answer. One of the questions is probably the one part where people spend the most time. And we really want you to take a little time to think about the response to this one question, because it will help us guide our services to make sure that they are most beneficial for you. And that question is, what can we do to help you transform your practice the most? So we really want you to take time to think about that response and be very open and honest with us, because that will help us help you. So I'll send that to you a little bit after today's call. And then once all of that is sent out, we will be working with the VCSQI team to set up a transition call. It will include the team there, our Vizient team here, and your practice. There will be a participation agreement, much like you signed with Virginia Cardiac, that you would sign with Vizient. We want to understand your current data collection. How are you getting that data information? We really want to help you take the data that you're collecting, make it understandable, and most importantly, make it actionable. And then participate in a VIC. That, again, is one of the questions that's in today's survey that you'll receive. And we really want you to think about who would you want to be in that VIC with. And then, obviously, all of these pieces here are going to let us finish strong. Each of us finish strong as we go through TCPI. So you've already seen me and Kirsty listed up here above, or before in the webinar. But we also wanted to highlight two other people that you'll probably be working with as we do the transition. And that's Gail Elliott. Gail is the TCPI data manager here at Vizient, and she is the data guru and fantastic to work with. I think you really enjoy working with her. And then Patty Harwood. Patty is our project manager for TCPI Advisory Services, and she really helps keep us organized and on our toes here. So I would also include in this slide Debbie and her team there at Virginia Cardiac as part of that transition team, because all of us will actually be working with you and your practice to help make this transition smooth and seamless. This here is my email address. You'll actually have this today when I send you the webinar and the survey and the PDF. But it is listed here. If you have any questions at any time, please feel free to reach out to me. As the nation's leading healthcare performance and improvement company, we strengthen our members' ability to deliver high-value care by aligning cost, quality, and market performance. All key pieces of the TCPI program. We just want to thank you for taking the time to join the webinar today. We look forward to communicating further as the transition to the Vizient PTN takes place. At this point, I'm going to take a moment and open up all the lines for everyone here so that you can ask any questions. Bear with me for just one moment. All right, everyone's line is open. So are there any questions based on today's informational webinar? Any thoughts? Okay, I'm going to take silence as no questions. Like I said, I'm going to send you the information here today, and you'll have my contact information, Kirsty's contact information. Please feel free to touch base with us if you have any questions about anything at all, and we'll be glad to help you. Final request, any questions as you think about any of this information that we just presented to you?
Shannon?
Yes.
Oh, hi. I'm sorry. My name is Jerry Hing, and, I was a little late attending because I was having computer problems. But I don't know if you covered this, but when does the project start with your company? Because I know it just ended with the other company, right?
With you, like the transition, when does the transition begin?
Yeah, when does it start? Yeah, right, exactly.
We are actually working with Virginia Cardiac currently, with Debbie and her team, to get that started. So what they'll be doing is they'll actually reach out to you and find some dates and times that work for you. They'll work with the Vizient team here, and we'll try to kind of find a time that works for all of us, and then we'll set up a call with you. Those calls, I believe, are going to start next week. So you should be getting some contact here within the next week or two.
Okay, sounds good. And then, as we continue, will we be meeting every week, or is it every other week, or how often?
The way that we have it set up, and I'll send this will be included in the presentation PDF that I send to you. There's going to be monthly calls, one, with your, what we call VIC, that's your Visiting Improvement Community. And then there's also going to be weekly drop-in sessions. Those drop-in sessions are kind of unscripted. If you just have a question about a certain milestone or a project that you're working on, you can drop in virtually and ask myself or Kirsay, she's the other quality improvement advisor here that will be working with us, and ask those. Those will be weekly, though.
I see.
So you'll have a combination of once a month, and then you'll also have those every week kind of freestyle calls, if you will, that you can drop in and ask questions.
Okay, sounds good. So will we be assigned to one person or anyone? Oh, okay.
Yes,
okay.
So it would either be myself or Kirsay. We're going to be the two advisors that will be working with you.
Okay.
You would work with one of us.
Okay. All right. Thank you. Sounds good. Thank you very much.
Sure. Great. Thank you. All right. With no further questions, we will go ahead and end the call. And I will reach out to you a little later today with those promised documents. Again, if you have any questions at all, please feel free to reach out to us. Thanks, everyone.
Thank you.
Thank you.
Thank you.